Hi, Beth. Good to see you again.
Likewise,
Thank you. How are you doing?
I'm fine. A bit of a brisk wind here today, but no vehicles are flying past, so I think we'll be okay.
All right. Lots of topics that I want to cover with you. But today I'd like to start with a topic that's near and dear to my heart. Can we talk about parents?
Oh, mm-hmm,
You know, we love them. We appreciate them. We do our
mm-hmm.
best in our dealings with them. But sometimes issues arise, and
Kidding.
yeah. Um, can you talk a little bit about that?
Sure. This is one of the, shall we say, one of the thickest and richest topics there that we could discuss or even think about. I'd like to focus on the pragmatic aspects because I could go on till I put everyone asleep with psychological theory and long-winded discussions, but that's not what we're here for. That's not what we're here for. We want to be practical, and we like to find solutions to issues that challenge us. So we're all pretty well aware of how little humans come into the world, and that one way or another, we're going to have a mom and a dad, regardless of how mom and dad are in the picture. And that's where it starts getting interesting, even before birth. Because when I look in the mirror, I see someone I like, that I find interesting, someone I'd like to hang out with. But also, newsflash, I haven't always gotten everything perfect in my life. When I was very little, I would have experiences, and not knowing what conclusions to draw from my experiences, I would come up with ideas, some of which would work for me, and others which may have seemed like they almost worked as coping at the time, but as my life went on, got in my way. So, for example, if I'm very little and mom frowns at me, um, at the time, she may just have a headache and not even be thinking about what it has to do with me. And I come to the conclusion that I'm a weird looking kid and I should shut up. Well, so I do shut up, and it gives mom a little peace to recover herself. But then I'm stuck, and not any fault of mom's, I'm stuck with this conclusion that I'm a weird looking kid, and that because I'm weird looking, I should keep my mouth shut. And if you extrapolate that, the old saying, as bends the twig, so grows the tree, that foundational mistake of interpretation carries with me throughout my life until I may someday discover it and question it and realize that it was a false conclusion. A colleague of mine once reported a man in his mid 40s who was overly shy and retiring from making personal connections. And they traced it back to when he was 6 years old, and somebody close to him told him he smelled funny. And when they examined it, his whole life opened up. Now, regarding parents, these are the people who influence us so very much. The mother, especially, even before we're born. We're in the womb, and the mother's hormones transmit through the placenta, through the umbilical cord to us. If mother has high cortisol levels and she's tense and anxious, we're going to have tension and anxiety even before we're done developing and born. If mother has a peaceful pregnancy with happiness and serenity, we're going to be flooded with the serenity and happiness hormones. And we're going to be a more placid, calm, confident person. Now, it doesn't mean that if I've had a difficulty as a prenatal or a little child that I can't learn. That's where someone like me comes in, where I help us to notice where these things came from. And in a sense, we become the adult in our lives that we always needed. And it's absolutely practical. I've seen dozens and dozens of people gain success with this in a very satisfactory way. Now, about parents, my mother, Winifred Livonia Gilly Baker. So I always wondered, ever since I was a little kid, who looks at a brand new born baby and says, I believe I'll call that child Winifred Livonia. Well, I was born in Appalachia, as was my mother, and her mother loved dramatic names. So that already tells you something about my family lineage. Winifred was something many times in a wonderful way, like having Bugs Bunny and Drag as a mom. She was creative, intelligent, funny, musical, incredibly entertaining. But this same woman had some very big challenges in her early life, chief of which, I think, on reflection, was that she was born right in the middle of the Depression in an especially depressed area. The family story that I heard was that she was the last of, I believe it was 6 children, maybe 7, 1 or 2 of which whom died. And she was born on January 3rd, 1928. And I was told that Grandma, her mother, was mopping the floor when she went into labor, and that the mop froze to the floor because they had nothing for fuel in the house and that there was no food. Now, if you imagine being born into that environment, as many millions and millions of people have been across the world in different ways, that's going to affect you. That's going to frame your view of life. And you're going to deal with it, or it will deal with you. And I think any of us could admit that beginning would present challenges. So she grew up deciding that she wanted to be extremely ambitious, pull her socks up, and make something out of life come hell or high water. And I can remember that. She wanted me to be Grace Kelly, not myself, when I was a little girl. I can just hear her saying, you should be willowy. Well, if you could see all of me, I'm about 5'9", and in my youth, I was the kind of girl you'd look at and say, that young woman could pick up a heifer under each arm and carry it around on the farm. So, maybe oak tree, but not a willow. Just an example. I'm going to imagine listeners hearing us right now would say, oh yeah, my mother wanted this from me. My father wanted that from me. And even though they may have meant the very best for us, this climate develops so that it becomes a difficulty for us, because there's one very fundamental thing every single one of us needs. Our parents needed it, their parents needed it, we do, our children need it. And that is what Fred Rogers so famously would say to the children that would watch his TV program, I like you just the way you are. I like you just the way you are. No improvements, no changes. You don't have to be willowy. You don't have to be the head of the basketball team. You don't have to be my son, the doctor. You don't have to be my daughter, the big executive woman. Just you. All you got to do is just stand there and breathe, and I think you're fabulous. Well, this gets lost in family systems. Parents have the pressures that they're suffering. They have their own unconscious motivators from difficult things that they suffered in their childhood. And we have a continuum. We hear a lot about narcissism, narcissistic parents, someone being labeled a narcissist, but I see a continuum. At one end, you would have absolutely no selfishness whatsoever. And I don't mean self-abnegation and amounting to self-abuse. I mean such peacefulness and confidence that selfishness was never be an issue for you. Frankly, I would point at that and I'd say, I believe that's God. I believe that's God. Maybe some humans have come close to that, but we all have inherited our own sack of wounds and challenges and mistakes in understanding ourselves in the world to pull us along on that continuum somewhere between no egotism and selfishness whatsoever, perfect serenity, all the way to what we would call um, the narcissistic type of personality. And at the very end extreme, you have individuals who either because something neurologically went wrong in their development or because of repeated or chronic PTSD challenges, the mirror neurons in the brain that allow us to witness and listen to another human being and feel empathy for the extreme narcissist, the psychopath, or the sociopath, the mirror neurons are not firing. It isn't happening. This kind of state is almost impossible for excuse me, an individual in what we would call the normal, the psychologically normal or natural range, to even imagine having no sense of like, well, I could put myself in your shoes, maybe even just a little bit. These individuals are isolated in this bubble of their own, completely feeling cut off from other human beings. They feel that they are a person. I am a person if I'm this individual, but you are an object for my use. And if they're going to survive, they have to learn early in life to mimic empathy, even though they don't feel it at all. And at the very far extreme, there will be no remorse whatsoever for parasitizing, injuring, abusing, taking advantage of fellow human beings. None at all. Very chilling. We've seen horrible movies perhaps about this. But then we have the rest of us who are somewhere in the middle, ourselves included. Maybe we're a little closer to God than that. But, well, does the cat have an opinion? Does he want to ask a question?
Poppy says, carry on, just ignore me.
Thank you, Poppy. It's good to know you're supervising us. Um, but so we have a mixed bag, like myself and my mother, Winifred. Um, in the morning, I would have this wonderful welcome, and she would even make these cute little menus for breakfast. I mean, this is a great mom, right? And we would sing songs or whatever. But then somewhere in the course of the day, and let's face it, children, I used to say when I was raising my daughter, who, by the way, is a wonderful human being, that she was getting paid to press my buttons. Because, in a sense, almost in a sense, children are, because they want to know, do you love me just the way I am? So they will kick our tires. And they need to know, how much can I push on you, mom, and you still love me? And if we don't realize this, we can feel that they literally have been hired to make our days hellish, even the best of children. So, there I am with my brother, and we're starting to pick on each other and make a fuss, and then the baby chimes in or whatever. Well, this is exhausting. And who knows, she may have had menstrual cramps or had an argument with dad or whatsoever. And it would be triggering to her. And by triggering, I mean it would remind her of emotional suffering she had when she was a child, when she was younger, from which she had never healed. When I was born in 1951, in that era, it was not common for adults to get together to reflect upon their lives and to express a greater depth of empathy. We were trying very hard to recover from World War II and to press ahead and be what we called successful. How to succeed in business without really trying or whatever, and the bigger car, the bigger house, or even just to simply pay the bills and the stress that pertained to that. And so maybe my brother would do something that reminded her of an aggravating thing that one of her brothers did, or I would whine one time too many. And yes, I was an expert whiner as a child when I wanted my way. And this would be too much for her because it's like kicking someone in a weak knee or banging a scab that hasn't really healed. And the pain would overcome her ability to feel the love and connection with her children. And I think any of us who've been parents could identify with this. We can lash out. And even if we don't, we definitely feel it. I remember one time standing in line at the grocery, and my daughter was about 3 and pitching a prolonged fit. And I just kept murmuring to myself, I love my child. No infanticide. I love my child. I love my child. And other parents, other adults in the line were nodding to me and saying, yes, we know. Yes, we understand. In a million years, I would never have hurt my child. But I had those feelings, you see. And if we have a parent, a mother or a father who have a lot of wounds, and I'm not saying this to excuse their behavior, parents who truly injure their children, there's never an excuse, but there can be an explanation. Explanation and excuse are not the same thing. It's like they have a bank account for empathy and patience and perseverance and calm that gets used up. It gets used up, and then they're running on empty. So we have mothers who were trained by their mothers to emotionally manipulate their children and to use what my daughter used to call mom guilt or shaming or other kinds of devious, underhanded skills. It's kind of uncanny when you look at these situations. I've compared notes with other colleagues and with my clients, and you'd think they all went to devious mother school together. There's
Or
it's
read the
so much
same manual,
read the same manual.
for
Yeah, and
sure.
I really don't think these people got up in the morning and said, hot damn, I'm going to mess up my kid's life. They're trying to cope, but but we have our lives to deal with. And if I have been groomed and conditioned from an early age to consider mom more important than even myself, I'm going to grow up to be an adult who wonders why I'm always last in line in my own life. And then if I try to challenge that well established practice, I may feel things like anxiety and guilt, and I may have almost an impossible time breaking that barrier because unconsciously, the real belief and the feeling is I'm going to hurt my mom if I take care of myself. I could name you any number of clients I've had who have gone through this process, intelligent people, capable people with good jobs and what you might call success in life, but uncannily still putting themselves last in a way that does not serve them and really doesn't serve anyone else. Because if you stop and think about it, if somebody I'm dealing with has some degree of narcissistic habit, we could even call it addiction, manipulative, self serving habit, and I enable them to keep practicing that habit, it's really not that much different than enabling someone with an alcohol or a drug habit. It's an addiction. And I'm involved in the addiction with this person, keeping it going with them and putting myself in an inferior position that is not realistic. It isn't serving me. It isn't serving anyone else. What it is serving is to try to keep my anxiety and fear down that I'm going to hurt mom or I'm going to hurt dad. How many lives have we heard about where individuals have had the rich potential to lead a blooming full life, but keep holding back and just don't know why? Well, here it is. I mean, of course, there's other causes as well, but we're focusing on the narcissistic issue right now. What is the solution to this? Well, one is to collaborate with an educator and counselor like myself, and discover, where did this start? Not just to belly button gaze, but to actually get to the root of the difficulty and make re- real decisions about, how do I, as an adult, want to treat this child that is me, who once walked the earth, but now still lives secretly inside of me. If I saw a child being treated the way that I was when I was a child, as an adult now, how would I want things to go for that child? Having love and empathy and compassion. Well, that's what I need to give to myself. And to learn how to practice the skills of loving myself while being in a state of establishing appropriate boundaries with the mom or the dad that really weren't there when I grew up. How to do that and to get used to the alarm I feel in myself at taking this big venture with which I'm not familiar. I've had the belief that the world would fall apart, or my life or someone else's life would fall apart if I take care of me. And I get to find out a step at a time. It doesn't work that way. Of course, the parent that's used to getting a free ride off of me, off of the child, may make a big complaint and make a lot of noise. But you know what? They're going to get over it.
Can you give an
Yeah.
example, Beth, for people who like examples, of the type of parent who is used to, as you say, getting a free ride, and what they
Mhm.
do and what they say and how they control, perhaps?
Here's a good one. This happens to be a male person with whom I've worked, but has a mother who has been accustomed to making him, in many respects, fill the role of the absent male partner, husband, all of his life, middle-aged adult. And so rather than saying, I'm going to give a name, Sam, I need someone to help me get the second bathroom in good order. Can you do this for me? Says this. Well, my sister would like to come visit, but she won't as long as the bathroom isn't working. You see, passive aggression, guilt tripping, shame mongering. Like, if you weren't, the implication is, if you weren't such a selfish jerk, you would run over here and fix mom's bathroom right now, because your poor old auntie just, what could she possibly do? I mean, it's underhanded rather than direct communication. Now, I feel for this woman as well, because she had to be raised in an environment where she did not have permission to just come right out and say, this is what I think and this is what I feel, without painful repercussions when she was a child. But that doesn't make it okay for her to do it to her adult son. And because he's so used to it, he reported to me, he said, it was the next day that it hit me. What the heck was that?
Hmm.
And he said, I'm still trying to figure out, what do I do with this? I said, well, you know what I would have done? I would have said, get her a bucket. you but that's me. And that's not necessarily what's indicated in this case. Can you say a little tact here? But this would be an individual who does not have skill in being direct with what she wants and needs, and in facing up to the fact that her son and other people have the right to say no, no. And what happens after no? Well, there could be the big surprise that the son or daughter says, okay, I'm not going to do it, but let's see if I can help you problem solve with this. Mr. Smith, I've got his phone number, is really good with bathrooms, and he's not all that expensive. Or I will help you pay for this if you don't have the money, because no, I'm not going to do this for you. That would be, I mean, I find that is a very vivid example for me. But it can be, the joke about the mother who complains that a light bulb is burned out in her room where she sits in her easy chair, and then approaches the son and says, "That's all right. Don't bother with me. I'll just sit here in the dark." That's an old joke, but you know, it's
I think
it's
you all actually know one of those at least.
yeah,
Yeah.
yeah. And I mean, we laugh about this. I can remember my mother. I can't hurt her. She's gone on to the great beyond now, and I don't want to hurt Winifred. I hope she's happy with her creator, and I assume that she really is, which brings me joy at this point. But we had a situation in our family where one of my siblings got into a very big difficulty. It was a very serious thing, and I wrote to her. I wrote a letter because when we were younger, I'm the oldest. I was very pushy, and I wanted her to know that I had learned to give up being pushy and dominating her life, and that I cared about her. And I said, you know what? The decision you make is up to you, because she was being pressured very heavily by everyone else in the family. This is what you've got to do right now to save face for the family. And I said, I want you to know, despite how I used to be, the way I am now, you do what comes from your heart, and I will support you regardless, because I've learned to respect you. I've learned to respect your life. Well, it wasn't very long till I got a phone call from mom screaming at me, after all I've done for you, and you do this to me? How could you? How could you? You're going to put me in the nut bin. And it went on from there. She just couldn't believe that I would break ranks and that I would encourage my younger sister to exercise her own wisdom and her own inherent guidance, rather than to push things under the rug and make nice for the social face of the family. And I said, this is exactly what I'm doing. I think she deserves to be respected for who she is, and I'm going to support that. And yes, I love my mom, and she had wonderful qualities, but that woman never forgave me until after the day she died from that. And that would be an aspect of narcissistic mothering right there. And again, I'm not saying this to badmouth my mother or to build myself up or anything like that. It's just an example. And I'm absolutely certain that had she known how to do better, that she would have. Well, see the categories. The tail award.
I think the cat is getting hungry at this point, so maybe we'll take a little break and come back.
Sure.
We'll hold that thought.
Take a break, or we could stop here, whatever best suits.
Thank you. Okay, we're back. What I wanted to ask you, Beth, is what are some of the tools that you give your clients who encounter these situations with their parents as adults?
Well, there are what we could call tools or strategies. Emotional freedom technique, otherwise known as meridian tapping, helps us to resolve the imbalance between rational thinking and emotional reaction. And there are several others, but there's something that begins even before that, because when we have been children who, whether our parents meant to do it or not, whether they cared but didn't know what to do, or they didn't care, there is the issue of learning to regulate ourselves when we are little people. I mean, we're all aware a baby's born, and it's brilliant and amazing that a whole little human being who's even fundamentally healthy comes out of a man and a woman making a child. This is it's always a miracle. And so here's this amazing little human being, but no control over bowel or urine, no teeth, can't get up and run around. We could go into all the things that doesn't even hold his or her head up yet. So we have a human being who is more like a fetus, really, than a developed human, meaning that this is somebody who still needs to get co-regulation with the mother. And there's been a lot of talk about other people raising children. Mom is the gold standard biologically, period. I'm not even going to hear an argument about that because mom is the gold standard in every single way. This is the person to whom the child is acquainted most intimately and sharing the same genes. There's all this commonality. So a little person has a need to be warm and fed and clean and feel safe enough, but also to learn how to be a human. The great psychologist, Dr. Virginia Satir, used to call parenting people making, because we come with all the potential, but that potential doesn't come into play unless we get coached and supported and encouraged by our parents. So a child who is not noticed enough, we think about little children saying, look at me, mom, look at me, look at me. That they're
Right.
not doing that in order to be irritating. That child is literally passionately attempting to develop his or her own natural inner witness. I learned to notice me. I learned to witness and reflect upon myself and my own actions through my mother noticing me. And this is why it's so important for little children to be satisfied that they are noticed. And again, like Fred Rogers said, I like you just the way you are. And that doesn't mean rubber stamping, setting the cat on fire, or painting your baby brother. you know but it means that I am valuable and I'm somebody, and my actions are things that I do. My actions are not who I am. That's something I do. And as a child develops, the child will learn to reflect upon his or her actions and reactions from getting trained and coached and encouraged by mom and dad. So if I break something, well, I'm responsible for it, but I'm still loved as who I am. It's a big difference. I remember being maybe 3 or 4 years old, and I had a magnetic attraction to um, a, um, a porcelain lamp that my parents had. I don't, not that it was porcelain, but it was fired clay. Those were popular in the 50s. And I can remember seeing it across the room and talking to myself, now, Beth, don't touch it. Don't touch it. But apparently I wasn't co-regulated enough yet, because the next thing I remember is the lamp on the floor in pieces.
Oh, no.
Yeah, a kid thing. But
Mhm.
I don't have any recollection whatsoever. And this is not because of trauma suppression. It literally is so. My parents got things right sometimes. Like I got things right with my child sometimes. They didn't shame me for this. They cleaned it up. They told me, do better next time. And we went on with life. That's an example of wonderful co regulation, because I'm 73 years old. I remember, oh, yeah, I really shouldn't have done that. But I don't feel bad about myself for it in any way whatsoever. Multiply that by hundreds, if not thousands of times, and you've got someone maturing from a little kid who doesn't know from what is right yet to an adult who feels, well, it's like learning to ride a bicycle. You feel so wobbly at first, but then it becomes like you don't even think about it. It becomes part of you. So why am I talking about this? So if someone comes to me who has been raised in a way to feel retracted within and not so good about himself, sad or angry, frightened, and confused, and I don't know why. Why am I not getting ahead in my professional goals? Why is my love life so difficult for me? Why is this always not working for me? I wake up in the morning and I feel frightened. I go to bed at night, I feel sad. Where is this coming from? No, it's not just all mom and dad, but we will find that in there somewhere. And so, what do we do about this? We develop the very same thing that didn't happen adequately in the childhood, which is witness. I'm the witness. And I assist my students and my clients to get comfortable and get confident with self-witnessing. And you say, well, so what, Dr. Baker? You're just sitting there watching yourself, la-di-da. No, being able to apply current day decisions in a way that I can feel emotionally comfortable with, and I can allow myself to retire unknown but highly affecting me false beliefs, and I can embrace the truth about how it is. Well, I'm really not a stupid, ugly kid who doesn't deserve fundamental care or respect. Okay, my mom and dad didn't know how to handle that. They did it poorly. And I can see that now. I'm an adult and I'm able to make that decision and bring it into my heart. Now, you say, how do you bring it into your heart? There's a lot of different ways. I've been doing this practice for many, many years, and I have a large basket of effective skills. Some will work for some people, some will not. Others will be appropriate for them. One of the most effective ways that we can um, fill in the missing co-regulation, the love, the compassion, the understanding that didn't happen developmentally is to vividly imagine, and I love this skill, um, visiting with ourselves as a younger person, as a child, as a little kid, and offering to support that younger aspect of ourself to have what he or she really needs and wants. And this is not something that our adult self determines. We actually learn how to listen to what's in our heart, the younger part of us, and let ourselves have it. And it's a phenomenon of the human psyche, the brain, that any experience that is vividly imagined, especially if we have positive emotions with it, can become our emotional climate within us. So we know that the unfortunate, the unhappy, the deficient experiences really happened. We don't forget that. But the emotional charge can go flat, it can go to zero, so that the pain doesn't keep replaying in a loop inside of us anymore. And we can have the favorable experience emotionally. And we know that it's not like a hypnosis that makes us believe a fantasy or that we have amnesia about the trauma or the deficit, but it no longer matters to us anymore. We see it and we go, well, that was there, but I'm really not hurting from it anymore. And to me, this is brilliant. We don't have to go into a psychology where we brutally flail the individual with recalling terrible emotional incidents that continue hurting. That becomes over with. So, it's not like going to the dentist and getting poked with a sharp thing and where it really hurts. We don't have to do this. This was revolutionary for me in working with my clients, that I could equip my clients with skills to reduce and even dissolve all the emotional pain of trauma, of even complex PTSD, to make it irrelevant. And then we could proceed rather than having to take a person's case and have this person wrench their guts out for me, and it's re-traumatizing them. This made a total difference to me. It's like the difference because you go to a doctor and you have your leg is hanging at an odd angle with a bone sticking out. And the doctor says, okay, let's talk about what motivated you to get this injury. And then a year later, I mean, your bone isn't healed. Whereas with this kind of skill, you can set the bone and remove the pain and the suffering, and then you can, with ease, reflect upon and integrate with your life. Make absolute difference for me in my practice. Absolute difference. And of course, I think many of us know that another route of psychology is somebody walks into the office, they say, well, I'm anxious and depressed. Here's a pill. Take this. Goodbye. And you will never hear me advocate for that. There may be occasions where, with a skilled and capable and comprehensive medical care provider, that organic physical conditions are really present, like a vitamin deficiency or a parasitic infection. Believe it or not, parasites can make you anxious or depressed. That's for another video. Um, or a disease of some kind that needs to be healed, or a nervous system is injured and needs restoration. That's wonderful. But to refuse to go into what's in a person's heart and claim that an imaginary chemical imbalance in the brain is the root cause. And I know this has become enormously popular, and it's a big, big, big moneymaker for some people, but it is not to benefit for the clients, because further research has plainly indicated that there is no such thing as a chemical imbalance in the brain as primary cause for any kind of mental and emotional suffering. Now, there may be some very remote thing, like I said, where it would be, if you're very low in B vitamins, that it's hard for your nerves to work as they do. But this is not a drug that you're deficient in, it is a nutrient. And that's a whole world of difference. Okay, I digressed. But so when you work with me, we will have you check in with a really good comprehensive medical care provider if that's what you need. That is not my bag. That is not what I do. But there are some, if you do your research, there are some competent people that you can turn to for pragmatic and effective nutrition and health care provision. And I will always encourage that. Now, getting back to what do we do with the habit that we have developed, that individual has developed in conceding to an over demanding parent. And then there's the over demanding parent that you have internalized, that even when the parent isn't around, you're still obeying those invisible voices within yourself. Don't do this, do that. When we learn to take a look at that and make adult decisions about what we want to do with support emotionally, which I'm perfectly happy to provide, and I've been good at it for well over 2 decades now. I see magical and beautiful and even miraculous blossoming. And the reason for this is that humans have a natural sequence of development that every single one of us has to adequately carry through, just like plants. If you have a flower that isn't doing so well, you don't lecture the flower. You don't stand there and yell at it or try to shame it. You find out what's missing from the inside and you provide it, and then the plant can bloom from within. Little secret about me, which I'm open about, is that I really don't think I had the picture for fundamental adult emotional self-regulation until I was in my mid-50s. Now, just so you'll know, I understand that's really late. In some ways, I've been one of God's slow children, you know? Uh, and how did that change for me? Well, I had intervention with a colleague who was emotionally savvy as well as a medical professional, which was helpful for me. And we found out what it was that was missing for me in my co-regulation development, and we supplied it. We got it supplied. That's another story how I got it supplied, but it involved being heard and patience and having a chance to decide that I was going to love myself just the way I was, despite feeling like I was a floundering mess. And lo and behold, one day I began to realize that I wasn't flying off the handle like I used to. I wasn't panicking like I used to. And that I was able to carry myself through difficult and challenging situations without falling into despair and hopelessness and anxiety and panic. And it was a wonderful liberation, but it didn't happen from lecturing myself or taking pills or any of these other things. It happened because I was getting my needs met. And I think that's one of my big strengths in working with my clients and students is that because I learned so slowly and so much later in life, it's very, very clear to me what it is that it takes to be a happier human. And I absolutely love sharing that with the people that come to see me. That's one of the greatest joys of my life.
Thank God for that. And thank God for you, Beth.
Thank you.